Liposuction is basically sucking fat out of the human body and sculpting your body in a way that it looks good. So it's a sculpting mechanism to make you look better. It's very safe if it's done correctly. You gotta have it done by a person who's experienced and who knows what they're doing and is able to monitor you if they're doing it awake, or is able to administer anesthesia safely if they're doing it in a day op center, but it's extremely safe. Okay, so the better candidate is a person who has good elasticity in their skin. So their skin will pull back and retract to where you want it to be. People with very loose skin might end up with loose skin with the skin being looser after you do the liposuction. So they're probably more surgical candidates as opposed to liposuction candidates. The most common myth about liposuction is you're gonna lose weight. You don't lose a lot of weight with liposuction. You lose minimal amount of weight. It's a body sculpting mechanism. It's a way to make your body look better, to sculpt you, but you don't lose a lot of weight at all. So you'd be surprised how many people come to see us for weight loss from liposuction. Okay, so it's really not a limit of areas, it's a limit of volume. Okay, you can do about 4 liters of lipoaspirate safely as an outpatient if you're just doing liposuction. If you're doing another procedure, you can only do 1 liter. And if you do more than 4 liters, they need to be admitted overnight at the hospital. I'm gonna say what I always say, which is if you can lose the weight, maybe you don't need me at all, right? So if you diet, you might not need me to liposuct you. Other than that, no. Yeah, just, be as healthy as possible. No smoking. I don't like my patients to smoke at all. But other than that, just take care of yourself and be as healthy as possible so that the anesthesia is safe and everything goes well. It really doesn't limit me as to what you want to do prior to surgery. So I have them wear a very tight garment because the compression garment does help the skin retract back. I recommend some lymph massage also at about 2 to 3 weeks. And I try to limit heavy physical activity for about 3 to 4 weeks. Again, it all depends on the patient. If they're very thin, maybe 2. If they're a little heavier, 3 to 4 weeks. And it's heavy physical activity like CrossFit or triathletes. Well, you can ride a bike, you can walk, you can run. Ellipticals are good. If your job demands a lot of heavy lifting and repetitive motions, then I usually say give me 2 weeks. If it's an office job, give me a week. Full recovery where you've resumed your daily activities and you're exercising and you're doing what you did, I'd say about 4 weeks. Full results where when you look in the mirror, that's what it's gonna look like 4 to 6 months. The answer to that is whatever age they're healthy at. You could be 90 years old, and if you're healthy enough and your skin will retract, you can do liposuction. I probably wouldn't do it on anybody under 18 or 19 just because they haven't fully developed. But other than that, if it's medically safe, you can have liposuction.